Day 4 of the Seattle study tour brings us to the Virginia Mason Institute, where we're hoping that the 18 delegates can very much hear from the source, the first healthcare organization to embrace wholly the Toyota production system and then adapt it in the way that would suit health, how they went about doing it. Bearing in mind that Virginia Mason began their journey in the year 2000 and would describe it as being a continuous journey. One of the first insights I believe the group realized this morning is the need to have a management system alongside leadership. But the management system is really important to delivering quality outcomes that Virginia Mason have managed. Their adaptation, or to the extent to which they've changed the TPS system, is at the top of the pyramid, where Toyota would have customer. Virginia Mason have put patient. And therefore what falls from that is, in terms of their key objectives, the patient is always first. There is the focus on the highest quality and safety of care, the focus on engagement of all employees in their work and in the business of the culture of the organization, striving for the highest satisfaction that feeds the engagement of employees and improves the experience for patients and relatives. And that last but not least, to maintain a successful economic enterprise enables you to have the freedom to choose the improvements that you're making. And that actually delivering better value with less is something that the leaders in health today in the NHS are all too familiar with. And so a real ask this morning and a real question that people are taking back is, if they decide on a management system like this one, what cover and guarantees will they get from people who lead at board level, in the community level, political level? What will the air cover look like to ensure that they can enable them to make these changes that they've seen had a great impact at Virginia Mason? I think another insight that people got was through the discussion that they had with the medical director, who was part of the original change team here at Virginia Mason and made that journey to Japan, the first one that was ever undertaken. And she spoke about how doctors at Virginia Mason speak of the VMPS, that's the Virginia Mason production system, as a tool that enables them to manage the chaos of their days. And that's something that the doctors on this program really related to, that they needed to find enablers to help them manage what feels chaotic so that they could deliver better value, better quality outcomes. They all loved the 10 respect behaviors that they were shown. The first on the list was listening, but this thing that actually there's mutual respect for everyone's work is part of the culture that the leaders who were here today listening are really going to be looking for as they walk the Gemba that they've gone to have a look at. Gemba, the place where the work takes place, where the actual place where the work takes place. They'll be looking for evidence of the respect behaviors and all of the other tools that they've been shown this morning. I think the culture that Virginia Mason have managed to achieve through, if you think of the journey that started in 2000 and think of where we are in 2015, is that actually leaders know to stand out of the way of those who are doing the work, allowing those who do the work at the coalface to make the improvements. That actually the leader's role is to mentor, to coach, to support, to make possible, to give the headspace and the development for people who work in the microsystems at the front line or in the non-clinical areas to make the improvements that will deliver to the mission. That is, again, another area that participants will be taking back to look at. What do they need to put around themselves to give them that cover so that they can go and make the improvements that they know will transform patient care? A lean journey is a learning journey. And that's what we've come to learn from at Virginia Mason today.